Hello everyone and welcome to the next in our health presentations. This session is going to focus on pain and pain management following spinal cord injury. Pain is often listed as one of the most serious and certainly the most debilitating secondary health conditions that happens as a result of spinal cord injury. And this presentation is going to cover off what we can do about it and why it happens and various other things like that. All right, so what is pain? Pain is probably fairly obvious. It's an uncomfortable feeling generated by our body and brain to tell us something might be wrong that needs our attention. It's an activation of our nervous system in response to some kind of stimulation. It might feel like stabbing, pulsing, aching, constant, or many other sensations. Pain is complex, and there's lots that we don't know about it. So just briefly going across some of the different types of pain. Acute pain, it's sharp and sudden. It's usually related to an injury or illness. A cut or a break, things like that. Usually subsides when the cause is found and treated effectively or heals naturally. Doesn't last any longer than 6 months. And as I said, examples include broken bones, dislocations, or burns. Chronic pain is a little bit more complex. It's pain that lasts longer than 6 months and persists past when an obvious underlying injury has healed. And different types of pain that we can feel are so musculoskeletal pain in bones, joints and muscles, which is what I'm currently dealing with following a gym session that I had yesterday. Visceral pain, which is in the organs, or neuropathic pain, which is felt in the nerves, which is what we'll be talking about. So while we're largely used to musculoskeletal pain and pain caused by cuts and abrasions, neuropathic pain is complex, relatively rare in the general population, and that's an important distinction, and quite difficult to treat. While it is relatively rare in the general population, it is unfortunately quite common in those who have a spinal cord injury. It's caused after trauma to the somatosensory system of neurons, which produce the capacity to touch and feel. There can often be no obvious cause or cure, and it can be long-lasting and can be very debilitating. So those with spinal cord injury can suffer from pain in many different ways. And we're going to watch a video now, and please let me know if you can see and hear this. So this is a video from Philip Siddle, who is considered a bit of a guru on pain in Australia.
Yeah, got that okay.
Here.
Well, there are two main types of pain that occur after a spinal cord injury, and these are quite different. The first is acute pain, which occurs immediately after the injury. Many people experience this, for example, with surgery. And then there's also chronic pain, which lasts usually more than 3 months, and certainly within 6 months after the injury. And the important thing about chronic pain that's different from acute pain is that it can occur after the structures that have been damaged have undergone the normal healing process. The reason that we make the division between these different types of pain is that the mechanisms behind them are quite different, and that means that they require different treatment. So if we see somebody who has pain, it's very important for us to distinguish whether the pain is new or acute, or whether it's occurring on the background of a chronic or persistent pain condition. It's really important for us in terms of treatment to assess people and work out exactly what sort of pain is going on. And we know that pain takes various types. One of these types is musculoskeletal pain, which occurs when muscles, tendons, joints, ligaments are inflamed or damaged or strained. Some people also experience musculoskeletal pain below the level of their injury. And if this happens, it can feel quite different. It may not have the same typical features of musculoskeletal pain above the injury. Some people may not be able to experience it or describe it accurately, but they may notice other things happening, such as an increase in spasm or possibly an increase in their neuropathic pain. One of the other major types of pain that we see after spinal cord injury is what we call visceral pain, which is basically pain that's arising from inflammation or damage in the gut or in body organs. The other type of pain that we see is neuropathic pain, and this is very common following spinal cord injury. Neuropathic pain after spinal cord injury is very different from other types of pain and very different from musculoskeletal and visceral pain that we've just talked about. And for a long time, we didn't understand what was going on. How could somebody who had a spinal cord injury, who didn't have any sensation below the level of their injury, experience pain in that area? And for a long time, people, and even in some cases health professionals, doubted sometimes that people were experiencing real pain. But in the last 10 to 20 years, there's been a huge focus of research around pain following spinal cord injury. And now we have a lot more answers as to what is going on. We know that there is damage to the nerves near the site of injury, but one of the biggest causes we now know causing neuropathic pain following spinal cord injury is damage to the spinal cord itself. And there are a number of changes that seem to happen. There are very small, what we call inhibitory neurons within the spinal cord that normally block information travelling up the spinal cord towards the brain. What this means is that we have a natural gate that allows information going up towards the brain in the spinal cord. And when these small inhibitory neurons are damaged, this gate is left open so that in a sense there are more messages that are able to travel up the spinal cord, and the spinal cord becomes sensitised to information so that people experience more pain. In extreme examples, that can mean that even things like light touch or sheets just touching the skin can actually cause pain. And this is because the transmission system, the messages going up through the spinal cord, are not working in the normal way. And in effect, what is happening is that this gate is amplifying or turning up the volume on the pain. The other thing that we found out from research is that once there is damage to the spinal cord, there are new connections that form. And although the body is trying to repair or to heal itself, actually there seems to be faulty wiring that also contributes to a person's pain. As well as changes in the spinal cord, we now also know that the brain changes after a spinal cord injury. In effect, what the brain is trying to do is to adapt to the loss of information that would normally come up the spinal cord. And the brain is what we call plastic. It constantly changes. So if there is information not coming up from the spinal cord in the normal way it would, the brain actually reorganises and changes the way that it works. The problem is that it's been shown that once this reorganisation occurs, it seems to result in pain. Even after a spinal cord injury, it's still possible to use the principles of the gait and of a volume control. I mentioned before that after a spinal cord injury, these small inhibitory nerves get damaged that control the gait in our spinal cord and brain. And during and after spinal cord injury, parts of this inhibitory system that control the gait remain significantly damaged. And these changes and this damage can generate pain messages or amplify messages that are coming up the spinal cord. The good thing about these gates in terms of control is that these gates are present in the spinal cord and also in the brain. And what that means is that even if the gates are damaged in the spinal cord, there are gates in the brain that can still control the amount of information and the amount of pain that is going up towards the brain. And what is even more important in terms of being able to manage pain is that there are some very simple tools that can help to close the gate no matter what the level or the type of spinal cord injury. You can find some other very helpful information about how the brain and the spinal cord work in pain, and also how the gates operate in another section of our website. There is a video called Introduction to Pain on the For Everyone section of this website. And if you go to there, you'll find more information that tells you about some of these processes that are going on. We used to think that the nervous system was fixed. In other words, we thought that it was a bit like telegraph wires that just transported messages from point A to B. We now know that the spinal cord and the brain are plastic, that they can change, either with pain or with spinal cord injury. And that means that it varies according to the messages that are coming in. So with plastic changes, what happens is that there are what we call secondary changes that occur as a consequence of pain or spinal cord injury. What that means is that as a consequence of the spinal injury, there are changes that happen further up in the spinal cord or further up in the brain that contribute further to the pain. The good thing is that some of these changes are reversible. Again, they're not fixed. The brain still remains plastic. That's good information in terms of treating pain, because it means that there are things that we can do to actually retrain the brain and reverse some of these plastic changes. The good news that we've learned from this information around neuroplasticity and gaits is that we now know that we have a range of very specific medications and also techniques that can help to close the gait and reduce the excitability in the nerves in the spinal cord after spinal cord damage. And that means that we can reduce the pain. The other thing is that we can also learn a range of strategies or skills that help to self-manage pain. This means making the most of the body's own natural healing potential. So trying one strategy isn't going to work. Each of these skills and tools has a different target, and to get the greatest benefits, important to use them all in combination. So things that we should definitely have in our toolbox for helping with pain are medications, which can reduce the hypersensitivity in damaged nerves and also in the spinal cord. Exercise and stretching. These can help to reduce muscle stiffness, to help increase the range of movement, and very importantly in terms of pain, to release endorphins, our natural morphines that are contained in the brain and spinal cord and are released in response to exercise. Also, thought challenging, we know, can help to retrain the brain. Things such as meditation and relaxation, these are techniques that help and optimise the body's ability to close the gates and to reduce the volume of pain messages. We also know that rest, relaxation and sleep are hugely important in terms of managing pain. If we have less sleep, we know that pain can increase. So it's important to try and get all of these as much as possible. It's also good to have what we call a pacing plan, which means breaking up activities so that they don't result in increased pain. It's also good to have some goals and thinking through how you might like to achieve those, and also having a pain flare-up plan, ways of dealing with your pain when it becomes more severe than usual. It's great to have some skills and some tools for managing pain, but it's very important to be patient and persistent. Some of these techniques do take a while to put into place and do take a bit of practice, and changes aren't always going to happen overnight. So it's important to put them in place and practice regularly, and then after a while you start to enjoy the rewards. So pain can be very complex, and it may be helpful to have other people to learn some of these techniques and to have a strong team around you. There can be people like your GP, your case manager, or your specialist who can form part of this team. So you may find it helpful to go to the website and download the health plan, which is available, and take it along to your health care team and use this as a central communication device for all of the people involved in your care.
All right, so that was Philip Siddle, as I said, a bit of an expert on pain management following spinal cord injury. And just to sort of...
Yeah, Phil, will you be able to send us that website
Absolutely.
information, please?
Absolutely.
Well, it's coming up,
Yep.
is it? Okay, sorry.
Yep, absolutely.
Thank
I'll send that through. Yes, so just to sort of recap a bit of what Phil said, pain can be very debilitating for people with a spinal cord injury. It can lead to you withdrawing from social events and from the things that you enjoy doing. And something that Phil didn't really talk about, but is worth mentioning as well, for certain people, depending on your injury level, pain can be a trigger for autonomic dysreflexia, which is a serious and life-threatening condition that can
Yeah,
occur.
I've been in hospital twice with that. It's not very nice.
No, certainly
Yeah.
not.
Not fun at all.
No,
Certainly something you want to
the
avoid.
first time I went, the paramedics, as soon as they saw me, they said, well, "That's what you've got." So I went in there with my wife, and the nice little Asian intern examined me and said, "Oh, you're having a panic attack. Here's some Valium. Go home." So 2 days later, it came back again, and I then spent 4 days in hospital. So yeah.
Yep.
Mm.
Yep. And it's something that a lot of, well, some, as your experience, a lot of medical professionals
Yeah.
don't necessarily know a lot
exactly.
about.
They've never heard of it. That's why I've got it on my medical alert bangle.
Yep. Yes,
Yeah.
and we'll be doing a dedicated session on AD in a couple of weeks' time.
Excellent.
All right. So pain can be caused by many things when you have a spinal cord injury. And just again to recap what the video said, it could be caused by other damage sustained to your musculoskeletal system during your initial injury. Could be caused by neuropathic pain. Could be caused by bladder and bowel issues, so constipation or a UTI. Could be caused by spasm. Could be caused by pressure injury. It could also be caused by wheelchair propulsion, overuse in the shoulders, and also a poor fitting wheelchair.
Also, wheelchair mishaps.
Yes, as Lily is wonderfully demonstrating there.
Yeah. Broken thumb.
So we've talked about some of the causes, but what can we do to help? So the main thing, the most obvious thing, well, it might be obvious, it might not be obvious to some people, is trying to identify the type of pain that you're in and what could be causing it. So in Lily's case and in my case, we know what's causing our pain. It's fairly obvious in both cases, but for neuropathic pain, it may not be as obvious. So speaking with your GP or your spinal specialist is a very good place to start. There are medications, many medications out there, and I understand that Richard has got a list of many of the medications that he's been on over the years.
I've sort of got a list which I won't go through, but I've got a list of over about 15 that didn't work. So I've had the injury for close on 16 years, but the past, say, 4 or 5 years, I've now got them down to a level which is acceptable to me, even though some of the medication, the doctors would rather have a larger dose, but I just can't handle it.
Yep.
And the other interesting thing was I take a powder, Ultra Muscle Ease, which is a magnesium supplement, and I found that to be a great help for my leg pain.
Yep. Yeah, I've heard that mentioned a couple of times recently, the magnesium.
Yeah, and that's, I don't know if it's available on script. I just buy it over the counter.
Yeah. Yep. But with medications, it is important to do in consultation with your doctor, because a lot of the pain medications out there can be highly addictive, depending on which ones you're taking, and they can also be dangerous.
I tried like fentanyl and OxyContin, but I was up against the ceiling.
Yeah, and
do you want me to
they
go through them now at the moment or later?
You can go through them now. Absolutely.
Okay. Well, the best ones that I've had is Neurontin or gabapentin. I take 1,600 mil a day. I take a 600 milligram at 2 a.m. in the morning when I have my catheterization. I take another one at 4 o'clock at night, and then I take a 400 mil at 10 o'clock in the morning. The big drug that has really helped has been Palexia, slow release or sustainable release. I take the 50 milligram dose twice a day, 2 o'clock and in the morning and 2 o'clock in the afternoon. For the UTI, of course, I've got cranberry powder. But the main thing that's really helped is this Ultra Muscle Ease, which is over the counter at the chemist. It's quite expensive. It's about $70 a container. And there's also a smaller one that's the night one. I've tried both, and for me, this is the one I take. I take just a scoop at lunchtime. With the wheelchair, which you make, it changing position regularly. I've got a Permobil F3, as Patrick knows, and the reason I got that was the fact that I can tilt in space, but also move my legs constantly. I find if I sort of sit for too long, say in a coffee shop or something like that, and I forget that I should be extending my feet occasionally, then I do end up with pain that takes a while to go away. But if I can sort of get in the habit of moving my legs regularly, moving my feet around and tilting in space, and that it does help. The trouble is remembering to do it, but by the time you got the pain, it's a bit too late. Yeah. You get sort of interested in doing a jigsaw or reading a book, and an hour later, oh shit, I should be moving my legs. Yeah.
Yes. Yes, absolutely. So yes, as Richard just said, looking at your assistive tech, such as wheelchairs, and how your body is positioned in them, may be contributing towards the pain, and fixing that might be a solution. There are also many alternative solutions for pain management. So there are alternative medications out there, such as CBD, that have effectively been proven to help with pain management. Not for everybody, and it is a personal decision, weighing up the risks with the rewards of that, but it may be effective for you. Rest and sleep.
What do the initials stand for?
Sorry?
What does CBD stand for?
So CBD is a offshoot of marijuana.
Oh, right. Okay.
So it's
Yeah. It's cannabis-based drug, isn't it? Yeah.
Yeah. Okay.
Cannabinoid something, which has escaped me right now.
Oh, yeah. Some of the states in America have legalized that, haven't they?
Correct. Yes. So it's without the addictive, without the element that gets you high, basically, which is THC.
Thanks.
So rest and sleep, meditation, massage, having hot showers and baths. Diet can also play a role, depending on what pain you're getting. It can help with blood flow and obviously weight loss as well, which can contribute to pain reduction. And we're just about finished. Nice short one today. You don't need to struggle in silence when it comes to pain. There are many organisations and groups out there that can help. So this is the link for the website that we had a look at before. And obviously our peer support team is available to have a chat about your individual pain and ways which you can mitigate it. And I'll leave that up for a second to let people jot it down. Does anyone have any questions or additional comments they'd like to make?
No, not at the moment.
No?
Thank you.
Excellent. All right. Thank you. Like I said, it was a relatively nice and short one today. Thank you.
Well, thanks very much. Nice meeting you again, Lily.
You
And,
too.